Do not move your patients when they are unstable. Don't put yourself in a situation where you're in the middle of a hallway or you're in CT scan or MRI or some holding bay for a procedure and your patient's crashing.
The Shift Report.
It doesn't just go with my situation here. There are times where physicians will come in and say, oh, we need to take this patient to CT. And their blood pressure's in the tank. They're breathing really funny, like intubation funny. Their heart rate's all over the place, and they're just not stable. And I work in a teaching facility, so not every physician has the same level of experience. And throughout that experience, there are some challenges or there are some situations where a physician might feel it's really, 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 really important to get that diagnostic scan, but may not realize that, hey, this patient needs to lay flat for 5, 6, 7, 8, 9 minutes, depending on what study you're getting.
Right. And if they're having trouble breathing, lying flat is not ideal for them.
No, absolutely not. So I urge everybody, do not move your patients when they are unstable. Don't put yourself in a situation where you're in the middle of a hallway or you're in CT scan or MRI or some holding bay for a procedure and your patient's crashing. Stabilize them first. If you need to move to the ICU to stabilize them, do that and then have them go for that scan. Right. There's too many people who are just working in hyperdrive, but not really understanding situations and environments. Yeah. And I was a victim of that.
Right. But
after having decades of experience,
For someone like me who's a bedside nurse, I wouldn't even know where to begin.
The Shift Report.